I am very pleased to invite you to welcome tonight Dr. Mohammad Auais, and his talk is called The Power of Stories, Using Podcasts to Treat Ageism.
Last summer, and during a visit to my parents, I accompanied my father to an appointment with a famous medical specialist. The moment we stepped inside the private clinic located in an upscale neighborhood, the first thing that struck us how spacious and busy it was. I still remember the fancy waiting room with expensive furniture and several large screens around the room displaying recent TV interviews with the specialist we were there to see. It was clever marketing, presenting excellent educational material, at the same time showcasing the high profile of the specialist. People waiting in the room were coming from different cities and even from outside the country. But the moment we stepped outside at the end of our visit, my dad and I agreed we wouldn't be going back. The specialist is bright and good at his job, but there was something missing in our interaction with him. For instance, although my father is in very good mental and physical health, and he's quite health literate, the specialist directed his comments to me, the companion, instead of talking to my father, the patient. He did not take the time to adequately explain the terms he used or the procedures he recommended. He made some assumptions about my dad's health and habits that simply weren't correct. He just wasn't sensitive to my dad's needs, and he didn't connect with his patient. While this visit happened outside Canada, and I'd like to think it is an isolated event, unfortunately, it's all too similar to other things I have witnessed in my own career here in Canada and elsewhere. I'm a physical therapist as training and an assistant professor in the School of Rehab Therapy. I came to Canada as an international student, lived and worked in different cities around the country, but then came to Kingston and fell in love with this city, and here I am at Queens. I live the experience of caring for older adults from different perspectives. I'm a son of 2 seniors. I'm a licensed healthcare professional who used to work with older adults. I am a university instructor who specifically teaches on this topic. And finally, I'm a researcher in this field. When I reflect on my experience with my dad and the specialist, what I see is a classic example of ageism. You may ask, what is ageism? Ageism is negative attitude, stereotyping, or discrimination against older people. It is a significant challenge facing healthcare systems around the world. The literature backs this up. Having ageism in the healthcare system looks like older adults being undertreated or even misdiagnosed for common conditions, being subjected to paternalism, or having decisions forced upon them. Perhaps you too have witnessed similar instances of ageism in the healthcare system. And the COVID-19 pandemic has only amplified this, not only in the society, but also in healthcare settings. So why is ageism in the healthcare system an important challenge to deal with? When health professionals hold negative attitudes towards aging, that harms the quality of their care. Research shows clearly that ageism is linked to worsened disability and poorer health. But here's an even bigger problem. Negative attitudes towards older people means health students, our future healthcare providers, aren't interested in working with older adults. This is further compounded by the continuing growth of the aging population here in Canada and elsewhere. So the number of healthcare providers who are qualified and choose to work with older people is lagging behind demand. Just how unpopular is it to pursue care for older adults as a specialty? I'll give you an example. The numbers are stark. Here in Canada, we have just over 300 physicians specialized in the care of older adults. Now we have more than 7 million seniors. So on average, there is one medical specialist to care for more than 23,000 seniors. This is a worldwide problem, and it's not limited to any specific health profession. The attitude of healthy students suggests that these low numbers might not change anytime soon. A number of studies found that students express little interest in working with older adults as a specialty, even when they report positive or neutral attitude towards aging. So this student attitude is a major challenge that healthcare systems need to address. But how can we address this? Can we even change students' attitudes? I believe that health instructors can play a significant role in reversing this trend. We just need to find innovative and compelling ways to change the attitude of future healthcare providers. I'm passionate about addressing this issue, and a few years ago, I decided to tackle this in my own courses. I teach a gerontology course for future physical therapists. And I want to share with you today the story of an initiative I used in my own classroom. Before sharing my story, I want to ask you a question that I spent a lot of time grappling with. What is the most effective way to change attitudes and behaviors? Since the beginnings of human civilization, storytelling has been a powerful way to bridge gaps and bring people together. When a story catches our attention, we are more likely to grasp the message than if the same message was presented in other formats. When we engage with a story, we even react physically. We might sweat more, blink faster, change our facial expressions. Our heart rate might go up, even our brain waves might change. What's more interesting, when a narrative is over, its effect can linger. Tales forge connections between the teller and the listener, and they improve the listener's empathy with the teller. So my hypothesis was this: if I could deliver older adults authentic stories to my students, that might help improve their empathy and attitude. And it was important for me that students hear from the seniors themselves. If I could empower an older patient to tell his or her own story, that might help students see the human being inside the older patient. So this was my hypothesis and plan. Now, how do I do this? How best to connect students with older adults' real stories? It turns out the logistics for arranging for a class of students to work with seniors are complicated. Whether it's bringing seniors to campus or students to seniors, it's difficult. I also worried that older adults might not like sharing their own stories in front of other people. So I knew from the very beginning that I needed an innovative way to overcome these challenges and connect my students with seniors' stories. And the answer for me lay in one word: podcast. Podcasts are user-friendly. They don't need sophisticated equipment or training, and they are inexpensive to produce. Podcast made it much easier for volunteers to share their stories. Many felt much more comfortable sharing their stories from the comfort of their homes than coming to campus. From students' perspective, emerging research shows that students prefer podcasts to textbooks for learning because they provide several advantages for the learner, including accommodating students with varying study habits, reducing stress and anxiety, and allowing students to engage in other activities while learning. There's one additional advantage for using podcasts in this case. Podcasts seem personal, as the narrator tells the listeners about their own challenges and story individually, directly into their ears. To make this happen, I partnered with the Office of Professional Development and Educational Scholarship here at Queen's Health Sciences. We formed a team with various expertise to evaluate and pilot this initiative. We ensured to include in the team a talented health student, not only to help with the project, but also to provide feedback from a student perspective. We called the podcast GeroCast. We started looking for volunteers who are willing to share their stories. The response was very positive. For some topics, we got more volunteers than we were looking for. I guess they saw the value of the project. Each episode featured one story that was told through an interview. Within each episode, we included reflection questions for students. We literally asked them to pause the recording, reflect upon these questions, and then continue listening. At the end of each episode, we included related assignments for students to work on in groups. What we ended up with was an interactive experience in which students could take their lessons learned from the podcast and apply them into practice. The themes of the episodes ranged from social isolation to experience with substitute decision making and legal guardianship to caring for someone with dementia. Through the convenience of audio recording, my students heard Shayla share her lived experience as a senior with urinary incontinence. Shayla spoke about what it's like to live with urinary incontinence, how that affects her day-to-day life. She also spoke about her interactions with different healthcare professionals and the health system, and she told the students about her success managing her condition. In a second episode, my students met Nancy. Nancy is a retired nurse after 40 years of caring for patients. She told the students about her lived experience as an informal caregiver for her mom. She spoke about the challenges she faced, but also the value and the meaning she found in caregiving. In another episode, my students heard the story of Adrienne and her late husband, Ron. Adrienne and her husband lived together for 56 years, and her husband has some serious illnesses at the end of his life. Adrienne took my students in a journey to understand what it really meant for her husband to live with serious illnesses, how that affected the quality of his life, and how he ended up taking the difficult decision to go through assisted dying. She spoke about the impact of this on her and her family, and she discussed their interactions with the healthcare system throughout this journey. Now, this was also a research project, and we wanted to evaluate it. So we surveyed the cohort of students who took part in the pilot trial of this initiative. we really wondered if we were successful in influencing students' attitude. The results were really exciting. The findings supported our initial hypothesis that using storytelling as a medium delivered through podcast could positively influence students' attitude. The vast majority of students said that podcast was an effective strategy to learn about older adults, and this increased their understanding of issues facing seniors in our local community. An overwhelming majority of students said the content of the podcast was relevant to working with older adults in the future. And I believe it is the personal nature of these episodes that made this a success. Students commented that they liked the fact that they heard the stories told by older adults' own voice. They felt that this broke down barriers between them and older adults. Some of them noted that they were able to hear the emotions of the seniors telling their stories. As one student put it, listening to these seniors makes you feel their story and see their struggle. But most importantly, what we heard was that GeroCast promoted empathy with and compassion for older adults. In addition to the GeroCast initiative, I use other evidence-based strategies to improve student attitude. And I believe the change I see at the end of the course is a result of all these together. There are several indications of the positive change happens at the end of the course. But perhaps the strongest indication is that many physical therapy students come to the program hoping to work with athletes, people with common musculoskeletal injuries, or even children. However, at the end of the course, many of my students commented that they are considering the possibility of working with older adults after graduation. I still remember one of my students. I'll call her Cindy. Cindy is in her 20s. She is a very energetic, sports-loving person. She came to the program with a background in athletic therapy, so she's not quite exactly the person you would picture working with seniors. Yet, at the end of the course, she emailed me saying, although she never thought she would enjoy a gerontology course, she is now considering the possibility of working in a geriatric setting if she can. What was reinforced for me throughout this project is that better healthcare starts with better education. In this project, we wanted to reach students, not just in their minds, but in their hearts. However, my bigger lesson here is that listening to seniors' stories is important. Humanity is important. Connection is important. Because it turns out that it's a sense of connection that can really change people's minds. And in turn, this has the power to change our healthcare system and improve outcomes for the most vulnerable patients. Any health system should be appraised by how well it cares for its oldest, most vulnerable patients, not just by the advanced technologies and the amount of funding it has access to. When I think about the healthcare system I want to see, I think of my dad. I want to see a healthcare system where my dad's needs are heard and validated. I want to see a health system where my dad is looked in the eye and provided thoughtful advice by those who provide his care. I dream of healthcare settings where all older adults feel respected, connected with their health team, prioritized, and cared for with empathy and compassion. And I know we can do that, one story at a time. Thank you.